Okay, good afternoon, everybody. Thanks for joining today's CR2C2 seminar series. Um, this seminar series are happening typically on Thursday, and today we are having this seminar hosted by the Clemson University. Please, before I pass it to Dr. Pam Murray, so make sure to have the mics muted, and at the end we will have the opportunity to ask the questions as well, and the chat box will be open to answer the questions. With that, I pass it to Dr. Pam Murray to introduce the speakers for today.
Hello, everyone. Thank you for coming this afternoon. Our speaker today
You're
is
muted
Mr.
and we cannot hear you.
It says I'm unmuted. You can't hear me?
I can hear you. Yeah,
Okay.
I heard you just fine.
Okay, so starting again. Good afternoon. Our speaker today is Mr. Don Strickland from the PD Regional Transportation Authority, where he is the executive director. And before that, he was the transportation manager. He has dedicated his career to ensuring that individuals in the PD region have access to reliable transportation and has been instrumental in fostering collaboration between governments, businesses, and community organizations to enhance public transit. In addition to this position, he is also the president of the Transportation Association of South Carolina, where he collaborates with many agencies across the state promoting public transportation. And he's here today to give us the perspective from a rural transit authority and communities. Thank you.
Good afternoon, everyone. Thanks for that kind introduction. So you'll learn quickly that I ramble a lot today, and but we're going to try to get through all the content that I have for you, and I do look forward to the questions later. But first, I mean, it's just a privilege to be able to come and speak to you all and present today. We, you know, when you think of rural, that really is the PDRTA, and I always get ahead of myself with my slide deck, but you'll see that we cover 6 counties of very rural territory. I mean, there's places that we're serving where there may be a mailbox every 4 or 5 miles across our region. And there's some places that's more like a small urban in Florence where it's not, and it's a little more population dense, but not nearly the vast majority. I'd say 95% of our coverage area is very rural communities, and there'll probably be a few stories along the way of just, you know, how public transportation has impacted, you know, those communities and why it's important and why we have to continue to fight every day to be able to sustain and grow those type services. So again, it's my honor to be here, and we'll get started. PDRTA, this is our mission statement, dedicated to providing public transportation with the highest degree of integrity, respectfulness, and efficiency across 6 counties in the PD region. We are the 3rd largest RTA in the country based on square miles, but we're currently serving the 6 counties that I mentioned. We also have services running from 2 of our counties all the way to the Grand Strand, where most people know where Myrtle Beach is, but we take quite a few hospitality workers to the Grand Strand. We've been doing that now for roughly 40 years. Our agency is 50 years old this past year. But currently, we have about 28 fixed routes. Some of those, you know, are in the small urban, but we have services across the entire 6 counties now at PDRTA. For many years, we brokered Medicaid transportation, and then when the state changed that model, PDRTA took a dramatic term, you know, downsizing, and a lot of folks were laid off, and we were cut back to roughly only 8 or 10 routes. And much of the growth that you'll hear about today has really happened in the past 5 or 6 years at PDRTA. Even through the pandemic, we were one of the only RTAs that were really growing services. But we'll speak to that 3,600 square miles a good bit, and the struggles and some of the positive things that comes with that. We're doing about 1.4 million miles a year. That's vehicle revenue miles. And we serve just over 400,000. We're actually trending right now. We'll be closer to 500, probably between 460 and 480 by the end of this fiscal year. Our average month now falls between 37,000 and 41,000 passenger trips. And for, big urbanized area, that doesn't seem like a whole lot, but when you're looking at the ruralness of where we serve every day, having that many folks board our buses is pretty strong in our region. I probably don't need to explain a lot of this to everybody, but we provide several different types of services. Obviously, your fixed routes where we have our designated bus stops along a fixed corridor where the buses are on a schedule and they run. We do have fixed routes in every county that we're commissioned to serve. We also provide paratransit and demand response services. And we'll talk about this more, but in our region, because of just how vast and how rural it is, although we do have fixed route services in all of the counties, what we're realizing is that the demand and need for more demand response services are critical for us. Not everyone lives within a half a mile or a mile of a fixed route to be able to access those routes. So how do you serve, seniors and veterans and ADA folks, wheelchairs, walkers, and whatnot, someone going to dialysis or cancer treatments, how do you serve them if they're not on the fixed routes? And so we have implemented demand response services in all 6 counties, but we're probably at about 20% of what we truly need in those 6 counties, just to be able to meet not even all the demand, just some of the demand. We're also looking at van pools as an option, especially for workforce commuter trips. And then as we'll talk about inter-county connectivity and how important that is, especially to the urbanized region in Florence, mainly because of workforce and healthcare. I'll speak to that some, but then that's where the park and ride model and idea comes in. And when you start looking to connect counties where there may be 30 to 50-mile trips or even a little further than that, why those will be important in the future. All of PDRTA's vehicles are ADA accessible. That's a federal requirement. Every bus that we operate has bike racks. One thing about our fixed routes, the fact that we do have bike racks, it allows, some of our commuters to travel. I mentioned, being away from the route some. So we do have quite a few individuals that will bike to a fixed route from their home, which may be off the beaten path or a dirt road somewhere, and they bike to a bus stop. They actually load their bike, and then they may get off at a stop and still may have a few miles to bike to get to where they need to. One good example is at Marion University. We have a couple professors. We actually have a route that runs to the university, but they bike mostly from home to the closest stop that will connect them to that route, which is pretty cool to have staff at a university using public transit the way they are, especially in a rural area. So we're seeing more and more of that. We do, those are mostly choice riders. They have the option. It's just something they choose to do because that's kind of ingrained in them. Every vehicle we operate has 6 to 8 surveillance cameras. They're definitely an important piece of that puzzle. We're actually now finally looking. We have some test pilots for wireless viewing. So technically, everything we've had in the past, you've had to go grab a DVR off of a bus. Whether it's an accident or a complaint, you'd have to go grab that DVR. The issue that when you have a coverage area as big as ours, that DVR may be an hour, maybe 60 miles from our main admin facility. So going just to chase a DVR could take half a day. So being able to add some wireless features there, so real time video, being able to see that will be a great addition to the services that we're providing. Our drivers go through a ton of training. There's another slide on this later, so I won't go into a ton of that now, but this is just a kind of an overview of our existing system. At PDRTA, I mentioned the 30 some odd fixed routes and then demand response services. The thing for me, this is probably the first time I've actually put all this on one slide, and it's just for me it's an eye opener. It shows kind of where we've come just in the past 5 or 6 years. if you look back to 2019, if you're looking at the Florence County slide day, I know this writing is kind of small here, but basically that Florence County section is predominantly what was running back then. We had a few other routes, but we've more than doubled our services in the past 5 years at PDRTA, just trying to do what's right and what's needed in the communities that we serve. And again, this is a combination of fixed route, demand response, commuter services to work, like those beach routes that I mentioned. We also have partnerships with a lot of other industry partners as well for workforce transportation. This is just kind of a slide that shows you just in those past 4 or 5 years, kind of where we're headed. This slide was done last year. It's actually, we missed that FY25 projection. We're going to be, as I mentioned earlier, probably between 460 and 480 for this fiscal year. So just a steady pattern of growth. Some of that is due to adding new services, but even on our existing services, if you compare where we were just 4 or 5 years ago, we've continued to have 12 to 15% growth every year. Just a few points here. So we're in the middle of our budget season, so I try to kind of highlight things to convince counties and cities and towns and other officials that make decisions on budgets, kind of why what we're doing is important. And this number, the first, a 4-to-1 economic return, I think it's actually 5-to-1 for public transit, but that's a source from APTA. That's 61.3 million. That's just and it's actually much bigger than that, but that's just based on an average of 40,000 trips per month using the same kind of calculator that they provide for an economic return on investment and tool. In excess of the 400,000 trips, we mentioned over 3,500 square miles a few times. We are, geographically speaking, not the amount of employees or buses, but the largest RTA in the nation when it comes to service area, or third largest in the nation. So we do a week-long survey twice a year on our entire services, and we ask a lot of questions related to purpose of trip, why folks are riding the bus, how often they ride, where are they heading, the purpose of the trip, just a number of different questions, how many vehicles are in your household, income, just a bunch of, and other demographics. But what we found most recently is that 59% of everyone that's using our fleet, when we asked what was the purpose of that trip, it was either going to work or coming home from work. And so roughly 60% of our passengers that ride that roughly 40,000 trips a month, they're using 60% are using it to get to and from work. 22%, so 23% is healthcare related. So we're doing a ton of trips, and we'll speak more to that, but working with a lot of healthcare providers in our 6 counties. Another big, major, interesting fact in our 6 counties that we serve, 77% of all those passengers surveyed say they have no car or no access to a vehicle in their household. And that's really telling. I mean, it explains, why the need is so great and why we need to do more of what we've been doing for the past for many years. But that's a large number of folks without a vehicle in their household. I don't know what the state average there is, but I imagine it's pretty large, but it's certainly not that large. We're at PDRTA. We're serving the Department of Employment Workforce has a kind of like a grading scale, and they rank counties from tier 1 to tier 4. Tier 4 being the most underserved, and it's based on household income and many other factors. But at PDRTA, we have 5 of our 6 counties are tier 3 and tier 4. In fact, all 6 counties are tier 3 and tier 4. So a lot of folks that really are transit dependent. But then you see 23% of the folks that report that they're unemployed but seeking employment. So when you factor in 60% of everyone going to and from work and 23% are seeking employment, that's a large number of our ridership that use the services every day. Another thing we asked, our folks is, what can we do better at PDRTA? And this is almost it's consistent every survey that we do, but basically expanded services, more frequency, later evenings, and more weekend service. So we right now, even in our urbanized area of Florence, South Carolina, our fixed route services end at 6 p.m. And what that means is that we take a lot of second shift employees to work that may get off at 8, 9, or 10 p.m. they're having to find other ways to get home. And many times those folks are walking home. And, we've heard on those same surveys that some of those folks are walking 4, 5, 6 miles home once they get off work because the taxi services, we have very limited Uber and Lyft, any rideshare programs in our region. So a lot of these folks are walking because that is actually their best option at that time. So moving on to just partners, and I'll mention partners a lot because one thing you'll notice at PDRTA is, and I'll share this, but we're really underfunded at the local government level as well as the state of South Carolina when it comes to our state mass transit funds. So the only way we've been able to have the growth that we've seen in recent years is really our partners. And our partners span from education, which we'll talk about here, and then the workforce component, as well as many in the healthcare fields. And that's our big three. And anytime we do surveys, those big three make up probably 90% of the ridership. So that's kind of where we focus a lot of our time on, is building relationships and really just formulating agreements with these different institutions. So like Francis Marion University, I mentioned them. We have a fixed route there that covers services about 11 hours a day. They are a partner and they help us with local funding to match federal funds. Obviously, anything that I mentioned when it comes to service is open to the public. Sometimes, it may sound like it's a dedicated service, but everything we do is open to the general public because it has to be. And otherwise it would be considered a charter service. Florence Darlington Technical College, we have a great relationship with them, but we actually have a program in place where students can use financial aid to purchase semester passes. And one good thing about those semester passes is they're able to use those services to get to school, but they can also use it to get to work. So if they have a part-time job or a full-time job, they can use their transit services to get around. And that covers really 2 or 3 of our counties. And then Northeastern Technical College is another community college that we work with. They cover the other 3 counties that Florence on Tech does not cover. And similar story, really good partnership with them. And the interesting thing with those 3 counties, in fact, 5 of our 6 counties, we're operating fare-free service. So there's no fare at all. We are currently charging fares in Florence County, which is our small urban, as well as our Myrtle Beach services. But everything else that PDRTA operates, just due to being able to offset any fare box revenue and local support from these partners, we've been able to provide fare-free services. And that helps us a lot because we're not having to chase $200 in a fare box that in a county that may be 50 miles away to bring that $200 back, count it, and then have to go deposit that money. So we'd end up spending $200 to go collect $200 to deposit it. Kind of makes me think of the situation where a penny now costs 3 cents to make. So being able to go fare free in those rural communities with PDRTA having one administrative facility and maintenance facility, it really does help us a lot. It cuts down road calls on fare boxes and other things. This Key to Career program is something we started about a year, excuse me, 1.5 years, 2 years ago. Very excited about this program. We're actually picking up students, juniors and seniors from 4 different high schools, and we take them to work every day. And they get out of school about an hour and a half early most days. And this service is kind of operated similar to demand response. But we take those students to work and been doing it for a while. This program is older than that though. So the data that I've been recently shared is that 70%, 72% of these students, when they graduate high school, they're getting full-time job offers from these organizations. Some of that is our local hospitals, Sunoco over in Hartsville, which is a pretty big plant. Just many, law offices, many different partners, even fire department. But these students, when they graduate, they're actually accepting job offers because they know, kind of that career path. They fall in love with it. They want to remain. So that it really helps, especially in rural communities. It helps keep some of the youth there and employed, instead of them going to our other major urbans. Like we lose a lot, obviously, to probably Charleston and Charlotte and Greenville. So this kind of helps retain some of those bright young folks to be able to stay and work locally. And then adult education is another great partner that we work with. That's folks going to obtain their GEDs, but we have a really good partnership with them as well as their ESL, English Second Language program. And basically, with that partnership, there's IDs that are printed that has the PDRTA logo. Those folks with the local subsidy and annual agreement, they also ride fare free, and they can use that same ID to be able to go to work, go grocery shopping, go to pharmacies. And it's just a great partnership, and they help us with some local funding as well. I want to share this video with you.
If I didn't have the PDRTA, I wouldn't be here. I would not be going to Florence On-Site, probably wouldn't even have graduated from here. Very thankful for being able to use it in Traverse, using it because I wouldn't have graduated from here if it wasn't available to me.
PDRTA is the public transportation provider for the PD region. We cover 6 counties, Florence, Darlington, Chesterfield, Marlboro, Dillon, and Marion counties. Florence Transit System actually covers Florence Darlington Technical College, and we're out there on campus about 12 times a day with connecting services from Darlington County. But a lot of students use our services. Years ago, we put in place a semester pass program where students could actually just use financial aid and not have to come out of pocket to be able to get to and from school.
You know, everything we do is about student success and workforce development. So this partnership was about access to transportation. When we think about our students have food insecurities, transportation insecurities, childcare insecurities, and some are working a couple of part-time jobs. But in order for our students to have postgraduate success, they have to have access to a quality education. It gives our students an opportunity to come to Florence Darlington Tech using PDRTA.
We provide a very vital resource to the people of this community, getting people to work, getting people to medical appointments, getting people to school so they can further their education, so that they can support their family, which in turn goes back into the community.
It helped me a lot. It's easier to get around Florence using the PDRTA than a regular car and bus because it takes you basically everywhere because there's a bus stop almost everywhere. There's a lot of helpful people that ride the bus too, and the bus drivers, they're very sweet people. They were able to get you to where you need to go, and they were also just like really nice to talk to.
We're moving with the purpose because they're going to school, so we want to get them on time. We don't want them missing classes, we don't want them missing exams, so we take a great deal of responsibility to make sure that everything is in line as much as it can be every single day.
But they're very punctual, and that's one thing that I really like, because if I needed to be somewhere at a certain time, I'd be able to ride there, and they'd get me there.
You talk about a home run success story. So here we have a student who was a student at Florence Darlington Tech in the welding program, needed to get to class, used PDRTA to get to class, finished the program, and she has access to a quality education, postgraduate success.
I am very thankful for them having the PDRTA system, and I hope that they continue to have it because it's a good use for people who don't have like reliable sources of transportation.
Past month, we actually had record numbers at PDRTA with over 41,000 passenger trips in a very rural region. So there's a lot of folks that are using those services every day. If PDRTA was not here tomorrow, about 1,500 employees would not show up to work tomorrow. You're probably looking at another 200 or 300 students that would not be at Florence Darlington Tech and Francis Marion and Coker. There's going to be many patients that's not going to go get their chemo and radiation tomorrow. A lot of dialysis clients would not show up for dialysis tomorrow. The big picture is it's a critical need, and it's a life source for a lot of folks.
I'm just eternally grateful that they had it, because if they didn't, my life would probably be very, very different from the way it is today.
There are many students in that same situation where they're looking to better their lives. They're looking to change the landscape of their families. Well, that's why coming to an organization like Florence Darlington Technical College and ridership usage like PDRTA is so important for the future growth of the region. So that's why not only this partnership is important, but it's also important that our students know what once was a barrier, such as transportation, is now being removed.
So we're going to move from education over to the workforce side of things, and in our rural communities, there's a lot of great stories, but I'm going to kind of lean on one that's in a very rural county of Dillon County, and it's a partnership relationship with Harbor Freight Tools. And it's a large, depending on the season, 1,500 to 2,500 employees is kind of where they've been. But several years back, they had a major issue with retention. Turnover rate was just astronomical, and they started doing more work internally to try to figure out what was going on, doing exit interviews with employees. And what Harbor Freight found was that just in their DC in Dillon County, they have about 4 million square feet over there of buildings and places where they are shipping, products out of. But what they found was that roughly 80% of the folks they were losing, mainly because of the attendance and points issues, 80% of those folks fell into a very small percentage of their employees, which were roughly about 10%. So as they were doing exit interviews and asking folks, why did you miss so many days? What's going on? It always, not always, the vast majority of time, it came back to transportation issues. The stories of 4 or 5 carpooling and a transmission going out, and now no one goes to work. Just story after story after story. So Harbor Freight really stepped up several years ago and partnered with us to be able to provide some services. And currently we're providing demand response services for them. It is open to the public, so we have other folks using it, but the vast majority are the Harbor Freight associates, because we're out there pretty early in the morning, 3 or 4 o'clock in the morning, with running demand response services door to door from individuals' homes all throughout this county. Covers about 3 or 4 different communities. Back to the main DC. And right now we probably have about 130 associates that's on our manifest. And every day there's probably 60 to 70 of them on average that are using the service to get to and from work across multiple shifts, 7 days a week. And it's just a great partnership, and one that we hope to be able to. We've already done very similar things with some other industries throughout the PD, but we're hoping to, we still have 3 or 4 counties we could do a lot more in. And that's really the conversation as we move forward into this new budget year, is how do we do more? A couple of those is Reese Foods here in the Florence area. And then we have a new battery electric plant that PDRTA is just now starting new services with. And Pepsi of Florence is another great partner. We're getting some employees to work there. They also do a ton of our advertising on our buses, which also is program income, and it helps us in the long run to be able to offset some of our expenses. One more video for you.
Hi, my name is Terrence Anderson. I'm the Division Vice President in the Dillon DC for Harbor Freight Tools. I've been working with Harbor Freight for about 6 years. We've been working with PDRTA for almost 8 or 9 years now. As we were considering the partnership with PDRTA and expanding it, one of the key factors in driving it was listening to our team. We're talking about the challenges of getting to and from work and being able to find reliable transportation. The cost of living is becoming higher and higher. And being able to provide a great job with great pay and be able to decrease some of the costs that our associates see outside of work helps them provide more for their families. PDRTA has been a great partner with adapting to our needs. As we came about different challenges, they were able to pivot and move just as fast as we were to be able to meet the needs of the team and drive a strong partnership that was able to provide high quality service. So as we've been able to leverage the PDRTA system, we've started to see our retention rates have been able to increase. One of the key factors that we noticed was that the ridership wasn't just happening sporadically. At first we thought that individuals would be riding the bus just in case, as an emergency. And now we're starting to see more continued and consistent ridership day over day. And just providing that opportunity has created other opportunities for some of our associates. Not only are we having an impact for our team here in Harbor Freight, but we're also having a strong impact on the community, because that's what's really important.
My name is Matt Patterson. I've been at Harbor Freight for 18 years, and I drive equipment and unload trucks, load trucks. The challenges I faced was walk to work, ride a bicycle to work, bum a ride, miss work. It helped my work life performance tremendously, but I was almost to the point of terminating just because I didn't have a reliable ride. This helped my workday go a little bit smoother, just to know that I have a reliable ride. As an employer, I would recommend PDRTA to other people for reliable transportation.
My name is Darlene Murphy. I've been employed with PDRTA for 13 years. My workday begins at 2:45 a.m. I'm at Harbor Freight by 3:30. Our area is so widespread that it's impossible to walk to work. So it's very, very important for these people to have this transportation. And I feel as if they do appreciate it. A typical day on the Harbor Freight route with PDRTA is conversating with my passengers and them talking to me about their walks in life and different day-to-day intervals they face. My passengers feel rewarded about knowing that they're going to get to work on time and knowing that they have a reliable source of transportation. Driving the Harbor Freight route is special to me. My people are my favorite part of my day.
I don't know if you can see my face, but just seeing her talk, it kind of brings a smile to it. But our drivers are really what makes the difference with our agency. And they, like she said, they really take pride in ensuring that folks are able to get, the resources and the things that they need to either make a living or whatever, that trip purpose is. So we have a strong group, and that's really the biggest thing that's kind of driven the change and allowed us to be where we are today. We do with our workforce partners. We've done so much work with, we go to the industries, we have lunch and learns, we'll schedule time to sit down. So our industry partners, they do internal surveys similar to what we do, and they gauge the interest. They find out, what employees truly need the service. If it was available, would they utilize it? And then they typically get a short list, and then we will go and we'll present, we'll share, tell them how to use the services, kind of walk them through the process. We've taken our buses over, kind of gone out and did a little mock run to show them, that our AC does work in the middle of the summer and our drivers are professional, the buses are clean. And sometimes just stepping on the bus, in the South, there is a stigma with public transportation, and the more we can do in that area, I think the better off we are, and folks understand that it is, truly a valuable service. So moving on to healthcare, a lot of partners here. This is not all of our partners, but this is definitely some of the larger ones. So the top row of logos you're looking at is the main hospitals that serve that's in our area. The Florence area really is the medical. They call it the medical mile, but there's a lot of options. That's where everyone goes for specialist, treatment. The McLeod Cancer Center, is right here in the heart of Florence, and being able to connect the rural counties to this area for workforce and healthcare and everything else is going to be vital as we move forward. But I'll speak just to a couple of these. The MUSC hospital recently opened, just in the past couple of years, past last year actually. They opened a hospital, Black River, that's between two small communities, Lake City, South Carolina, and King Street, and they put the hospital kind of dead in the middle of an area that's probably 6 or 7 miles from Lake City and about the same from King Street. The issue is transportation. So a lot of folks, where they built the location, they had a hard time getting from one community to the other. So we worked closely with them, and we were able to start the Black River Florence Connect route, and it actually is a service that because we started that route, it provides transportation from the Black River MUSC hospital all the way to the main site, because not everything's available, and they have clients that need to go back and forth. That's kind of a non-emergency, so you don't need an ambulance or a stretcher. That just really needs a reliable ride to be able to get there. So that service has been going very well since we started it last year. Ridership increases month over month, and just for them to have the insight to know that they needed to provide some resources toward getting those folks from those communities down to the hospital. It was really good. McLeod Health now, we have a partnership with them. Part of the biggest component is for their cancer center. So we're providing demand response services connecting all 6 counties back to Florence for the cancer center. And so every day we are out there picking up clients, bringing them to these appointments. They're getting their treatments and going back home. The one thing, and it's not McLeod focused. It's really everyone on this list. In the past, 5 or 6 years, one thing that was uncovered is without transportation, their no-show rates are between 40 and 50%. So that's people not making it to, life-saving type treatments and just things that they have to make. And so we're proud to work with each one of these groups. Carolina Pines, when I finish up today, I have another meeting with another regional medical center to talk about more of this type service. We also work closely with FQHC. So these are our community hospitals that operate as a nonprofit. They do extremely well in the rural areas, and we provide a ton of service for each of them throughout our 6 counties that we cover. Each of them are also local providers of funding for PDRTA to match federal dollars. And then below the vantage point is our seniors. A third of all South Carolinians will be a senior. So 60 or 65 and older, a third of our entire state is a senior citizen now, which is kind of unreal, but it also shows us kind of where we're headed and how important it is what we do every day. A lot of our seniors use our services. And there's nothing more gratifying than giving them a sense of independence and where they're not having to rely on family or neighbors or someone else to get them about. So they're able to use our services to not just do medical appointments, but anywhere, grocery stores, pharmacies, pay their bills, and they're doing that across 6 counties. Obviously, mental health, and then Mercy Medicine is another free medical clinic that we partner with and provide a lot of service to their front door across our region. Trinity Behavioral Care is another great partner of PDRTA's. This company, they work primarily in the very rural areas, but in the past 4 or 5 years, they deal with a lot of drug and alcohol dependency situations, and there's been spikes and suicide, and they really work with a broad group across the board. They actually will go and board our buses, and we allow them to do this, but they share their program with individuals that are using our services. So they send staff out probably once every 2 or 3 months, and they go out and use our services, and we allow them to take promotion, their documents on there. And it's not just about the individual, but it's looking out for their families. And the conversations is always, do you know anyone that may benefit from this type of treatment that's in a bad situation? So we're proud to partner with them, and we know that what the impact is that it's fruitful to be able to know you have partners like that out there doing work. So I talked about the demand response service. With what we're doing, we're providing next day service. So if you call us up to 5 o'clock today, we do have capacity constraints at times, but for the most part, we're doing just about everything we can to fulfill these requests. And so you call us today, we'll take you tomorrow kind of idea. And it is door to door. We don't go through the door type service, but we're doing that across all 6 counties. The Medicaid situation, right now, the state of South Carolina is using a brokerage model, but there's been a lot of hardship with kind of what's going on with providers. And I think the last report that Health and Human Services released that I saw last fall was about 41% of these trips are no-show, meaning that the actual providers are not showing up to take the individual. So we're thankful to be able to help that situation some. And then also, there's no requirement to wait 72 hours. If you're sick today, you don't want to wait until Monday to go to the doctor. You want to be able to go as soon as possible, so that we're happy to be able to provide those type of services. Just a lot of same day in certain situations. I put in here, had a young Hispanic child, 6 or 7 years old, had a severe broken leg, and they couldn't get any help. The family did not have any insurance, and it was just a bad situation for them. And it was none of them could speak English, so they were struggling. But we worked with Care South, and we were able to get an appointment about 50 miles away. Our driver took the entire family. We have a couple employees at PDRTA that are bilingual, so we actually, our HR manager was talking to the family, letting them know that everything was going to be okay and that the driver was not going to leave them in a town they weren't familiar with. And that's really kind of what we do. And so just it's outside the norm, I think, with the partners that we have. But that's the only way we've been able to sustain what we're doing now. So just I mentioned the partnerships, but I know we're getting close on time here, but really the relationship building is key for us. So for getting the right people to the table, identifying just the champions. So it's not always the best approach for PDRTA or the transit provider to go and be the ones that's promoting kind of what we're trying to do. So having the right people engaged and having them being able to be able to share the same story, that helps with bringing other partners to the table. It helps municipalities across the board. And then, having commitment. So, being able to get 10 people in a room and knowing that two of them are already committed and having them share how they're stepping up. Sometimes it allows the other partners, kind of puts them on a spot and say, well, if those two are doing it, we need to figure something out too. So that's been kind of the model, and it's been impactful. I think folks are probably kind of learning that's the way it works around our area, though. I mentioned our drivers earlier. They go to a ton of training. One thing that I'm proud to say is that every employee at PDRTA is first aid and CPR certified, and we try to maintain that for even our new employees within those first 30 days. We try to get that accreditation. So on the IT side of things, we do have mobile tracking, so anyone can download an app on their iPhone or Android device and be able to see every vehicle in our fleet, and it's called the Spot app. And when you download the Spot app, you just have to go in and choose which authority. They actually work with many providers across the country. And I mentioned the funding at the state level earlier. This is something we're working strongly with the new administration at SCDOT as well as our state legislature. But in 1987, there was roughly 6 or 7 systems in South Carolina that do what we do today. PDRTA was one of those systems, but we got $6 million from the fuel tax. Today in 2025, there's now 34 systems, and the dollar amount is still the same, $6 million at the state level. So we're working obviously hard to try to figure out how to change that. We need to make some headway, because what ends up happening is those funds help us with matching our federal funds, and many of the rural providers in the state do not utilize the federal funds that are a portion of them. So they end up not drawing it down. It gets reallocated and goes other places. So we've got to change this model at the state level. And that's one thing that that we're working on is try to improve this situation. Today, just based on the number of systems and just the amount of time from 1987 to 2025, that number should be closer to $60 million. So we're way behind. Actually, it's $80 million where it needs to be, but we're going to be able to make some progress here, because we really have no choice but to improve that. For us, it's, I won't run into all this, but this is another slide from APTA, but the funding, the economy, safety, and equity is really kind of things that we're focused on. And then with the more dedicated funding, it really opens the door for those inter-county routes, some more of those that I was mentioning, improved overall health access, better services for veterans and ADAs, more infrastructure, so our rolling stock will be replaced. A lot of our vehicles have met their useful life. More funding will allow us to do a better job with that. And then these internships, I love to see that across all 6 counties that we serve. And with that, that's my presentation. I know we're running a little bit late, so would love to discuss any of the questions we may have.
Thank you so much for that presentation. I loved hearing the personal stories because at least for our project, we were really trying to get a handle on what are the personal challenges that people are facing. Any questions ready to go? Otherwise, I have a couple. Okay, so I guess one of my questions is how how do you see your general users being comfortable with app type systems, or do they prefer to have like a more of a phone-based system if they need it? Do you have any idea about their technology comfort?
Yeah, and it's all over the place, to be honest. A lot of the seniors, they do prefer calling in and having the conversation. So our dispatch team, we have 4 or 5 dispatchers, and that's their priority really is taking those calls. So although we're moving more toward, being able to schedule rides on demand, having more of a micro transit model, what we're doing, just because it doesn't speak to everyone. And although most folks do have access to smartphones now, um, folks they really prefer, having a conversation, having that assurance that they talk to someone, they know that that ride is scheduled tomorrow. Because if you think about it, some of this is workforce related, some of it could be, like I mentioned, the cancer center. You don't need to miss that treatment. So knowing for a fact that you spoke to someone, they have that record, there is value there, and that's something. No matter how much IT infrastructure we put in place, I think those resources will always need to be there for the one-on-one. And we do travel training, so we have some folks who will actually offer to go out and assist them with how to get on the bus. We'll do that from their home and then help them get to where they need to get to.
I think that's great. That personal touch is definitely important in what we've heard from our limited interviews. We have one question in the chat that says, would automated shuttles similar to robo-taxis be relevant to your organization, and where would they work best?
Um, that's a good question, and I think the rural aspect of kind of what we see, there's times where we have to get creative on how to get to certain people. When I say that, it may be a 4 mile long dirt road, and you get to a point to where there is a bridge out, or there's another issue. So then you have to reroute. I think obviously in our small urban areas, we've seen it across the country. I think there's benefit there, but with the ruralness and kind of what we see, our drivers having to navigate and things like that, the demand response model for us is probably the safer route. I think obviously in the more urban environments where you're going to have more street side pickups and not pulling into someone's yard, and then I think about the ADA and our wheelchairs and walkers, and just how much hands-on that these folks need. I mean, our drivers are they're trained to be able to, we had legally blind, and helping them navigate the system. It really does take that hands-on approach.
We have another question as well from the chat that asks that the Harbor Freight program is very impressive. Are other corporations stepping up as well?
Yeah, so we have multiple conversations going on now with actually new industries that are looking to kind of mimic that model, maybe not even at the same level. We met with the company just this past week that produces quartz, and it's not the size entity, but they probably 100 associates. They have 15 or 20 that really need some assistance for workforce. So we're having those conversations. We have existing services in place for I mentioned like Pepsi and Reese Foods, and now we're under contract with the new battery electric plant, AESC, as well. And so yeah, the conversations are definitely spreading. We're hopeful to be there's more opportunities in some of our rural counties that we serve, and so that is a major focus for us moving forward is to develop more of those. Obviously, everyone has to have some skin in the game to be able to make those things work on the local level. So buy-in from the industries, the businesses, and from the counties and municipalities, is also important.
Thank you. Our next question is related to the emergency service that you mentioned earlier, but maybe taking it one step further. So, how about the integration of transit with evacuation plans, or what's your role in getting people to emergency shelters?
Absolutely. So that is a part of what we do. So I sometimes I fail to mention that because it's always there, but it's not utilized as often as some of our other programs. But we have agreements in place with many nursing homes. And in the event that there's a disaster, we can get them from the nursing home to shelters. We have agreements with our educational institutions, a few hospitals. But we're also involved with our emergency management. Our main office is only about 45, 50 miles from the coast. So we do a lot with hurricane preparedness and we've shuttled folks as far as Charlotte from our region to get them away from, get them out of harm's way to shelters from the coast. So that's something we always have to dedicate a certain percentage of our fleet to be able to assist, in those emergencies. But it's definitely a good point and something that I fail to mention a lot of.
We have another question from the chat as well. They say the new federal administration and Secretary of Transportation has focused on supporting areas of high childbirth. Any opportunities to link with your health services?
I certainly hope so. So I'm also working with on a few different fronts. There's a lot going on right now, but it is looking at one program is mothers and children and providing access and getting them back into the workforce. So basically customizing and doing things like being able to take the child and the mother to daycare and then take the mother on to work. And so it's not just mothers, it's for anyone, but being able to partner and do things like that, I don't see why it would not tie into the infants and childbirth. So I think especially in these rural communities, it's difficult. So we're already providing more demand response services to the medical facilities for this situation, working with the main hospitals and our FQHCs. I wasn't aware of the potential for additional federal funding dedicated just for that. So I will certainly look into that. I think it's something we should consider.
All right, thank you. Ali, you had unmuted earlier. Did you want to ask or say something?
Um, I, it doesn't look like that we have any further question at the moment, and it is almost 1 p.m. I just want to thank you, Don, for this great presentation, and also those who attended today's talk. It looks like that we also have a request from one of the audience asking for the slides. If you don't mind, if you can share the slides so that we can share the slides also with the audience as well. With that, thank you so much again, and to the speaker, as well as Clemson University for hosting today's virtually hosting this meeting, and those who joined this meeting. Thank you so much.
It was my pleasure, and thank you all for having me.